You are listening to a recording from the 2021 PM&R Scholars Virtual Residency Fair. We would like to take a moment to thank the residency programs who have taken the time to present at our fair this year. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap, the best resource for your Physiatry clinical preparation, audition rotations, board preparation, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and even oral board cases. Head to pmnrrecap.com to learn more.
Yeah, thank you. So I'd like to invite the next speaker for Stanford University.
Hi, can everybody hear me? All right, sounds good. So my name is Nathan Prabhakar. I'm PGY4 at Stanford PM&R. Today I'd like to give a broad overview of the Stanford PM&R program. Hopefully it's informative today. So going through the three main rotation sites for us, that's going to be at Stanford Healthcare proper, Santa Clara Valley Medical Center, and the VA Palo Alto. So going through a few of these rotations in a little bit more detail. The first one is Stanford Hospital, new state-of-the-art facility, ton of unique cases present here, primarily consult rotation for us with some additional neuro rehab exposure. You also have the opportunity to work with Stanford Student Health, as well as the Stanford Performance Center, where we work with the varsity and club sports there. So moving on to the Redwood City clinics. Let me see if I can get rid of this. So strong outpatient sports and spine training here. This is where we do our outpatient MSK blocks. We do EMGs here. It's a community sports medicine clinic. We treat a diverse variety of patients, a range of backgrounds and age groups. You'll see professional athletes here. You'll see weekend warriors. This is where we get exposure to our OSC, which is our outpatient surgery center, where we'll be doing spine procedures. And so, you get a ton of exposure to ultrasound procedures as well as neuroaxial procedures here. Next up is Santa Clara Valley Medical Center. So kind of our pride and joy for inpatient rehab. It's one of the high quality performing rehab centers in California with a associated level 1 trauma center. This is the newest building where the rehab wing is located, called Sobrato Pavilion. It really expanded kind of our nationally recognized state-of-the-art inpatient experience. It's got 64 rehab rooms, therapy gym, pools, a lot of unique cases. You treat patients who also come from a wide range of socioeconomic backgrounds, Medi-Cal patients all the way up to VIPs. A little bit more, kind of pictures of Valley. You can see we have therapy dogs, which is crucial, cutting edge technology with exoskeleton, robotics, other adaptive devices, and our pool, which is also state of the art and can actually adapt to wheelchairs as well. We also spent some time at Valley, not just doing inpatient, but outpatient. We have a neuro rehab clinic where we'll see our neuro rehab patients, as well as do neurolysis procedures, backlift and pump refills, and an ultrasound injection clinic as well. And the opportunity to rotate as a PGY3 with the neurosurgery clinic as well for some more spine experience. Our third main site is the VA Palo Alto, where we do our inpatient polytrauma, which is like multiple trauma as well as traumatic brain injury site. It's one of the few veteran acute rehab polytrauma centers in the country. It's been going on for many, many years. It's CARF accredited, just like Valley. We also have our spinal cord injury unit there. It houses our SCI fellowship. So that's our inpatient experience. We also do outpatient here, where we get outpatient MSK. We treat the veteran population. We also do EMG as well as procedures here as well. So for those unfamiliar with the Bay Area, this is kind of the lay of the land. Here's our three main training sites, with Valley being down here near San Jose, Palo Alto VA in the middle, Stanford Hospital, and Redwood City. So kind of a broad line along the peninsula and South Bay. There is a little bit of driving involved, as is the case when you're in the Bay Area, but generally, especially post-COVID, hasn't been an issue. And here's a map of where residents have lived or currently living. We try to kind of minimize the driving times and distance, and where residents live through the year kind of changes depending on what PGY year they are. We do a lot more inpatient rehab in our first year. Some residents choose to live down in the South Bay, and then they move on up towards Palo Alto, Redwood City, and we're doing more rotations over at Stanford. That being the case, we've had residents live all the way up in San Francisco, Fremont, all over the Bay. So it is definitely possible. I wouldn't necessarily recommend that, but it's definitely been done, especially when you think about cost of living and things like that. Here's a sample resident schedule divided up by 7 blocks through the year, typically 7 to 8 weeks per block. As you can see, starting with your PGY 2-year, it's primarily inpatient, but we have worked to make a change to our curriculum to include more outpatient experience early. So you will get a full spine block in your first year. And then moving on to the second year, you have pediatric exposure, sports and spine exposure. We have a unique rotation at St. Mary's in San Francisco, where you'll see a community rehab, kind of a private rehab experience. So see that side of PM&R as well. And then dedicated EMG block. That's not the only time you get EMGs, but this is primarily a procedural block here as a PGY 4. Talking about call, it is all home call, which can be nice. Average call frequencies, 1 weekend per month, 1 weekday per week. And as the residency progresses, less and less call. There's 2 call pools, Valley, which is an inpatient rehab site, and then VA/Stanford. Looking at, this is our Epic Secure Chat, which has really helped improve call, streamline call. So instead of beepers and pagers, we can just use our phone to put in orders, get pages, and communicate directly, not just when you're on call, but even when you're on service, to other teams, to other residents, attendings. It's been really nice and helps streamline the inpatient experience. So the bosses, we have Dr. Smook here and Dr. Levin. They're both interventional spine pain trained physicians who are primarily at the Stanford Redwood City Center. Dr. Smook is our chair. He's the SIS president, which is interventional spine, one of the premier organizations in interventional spine. He's also leader of the Wearable Health Lab, which is focused on biomechanics, gait, medical devices, and innovation. Dr. Levin, our program director, he is the head of our interventional spine fellowship, which is also housed at Stanford. Obviously, 2 well-accomplished faculty who are our leaders. A few of our Stanford attendings, we have Dr. Rowe, just a whiz at ultrasound, sports medicine. He was a team physician for the Winter Olympics in 2018. He's a consultant for some of our great winning Bay Area teams. And then we have Dr. Stanek, who gives us great exposure to performing arts medicine. Great teacher, won our faculty teaching award this year. Dr. Kraus, a Stanford graduate, sports fellowship graduate as well, who focuses in on pediatric sports medicine. And then Dr. Frederickson, who's a legend in the area of sports medicine and running medicine. He's also our sports fellowship director, a ton of different publications. If you're interested in sports, great place to be and learn from as well. A few of our Palo Alto VA attendings, Dr. Karandikar, he's amazing at teaching, a whiz at procedures, and just a pleasure to work with. Dr. Terioka, our site chief, Dr. Oda, who is the director of our Stanford VA Palo Alto SCI Fellowship, and then Dr. Timmerman, who is our DO faculty and director of the Polytrauma Network site. Getting a lot of chats, just want to make sure. Okay, get rid of that. Few of our Valley attendings. So this is our inpatient experience. As I said, Dr. Cruz, our chair, he's triple boarded SCI, PM&R, and electrodiagnostics. Dr. Hoy, he's our chief of brain injury. Dr. Varma, she is the site chief and very involved in education. Dr. McKenna, he is a internal medicine critical care physician who helps run the respiratory rehab unit, which is a very unique part of our program. Basically, patients with high cervical spinal cord injuries or other respiratory issues that may need ventilatory support. We co-manage the patients with Dr. McKenna as a primary. He's involved in a ton of cutting edge research, including some of the latest stem cell research for spinal cord injury. Our residents, we have 7 residents per class. Just a great atmosphere. It's one of the reasons why I wanted to come to Stanford when I was a medical student, and really is a highlight of our program. Great collegial atmosphere. This is us in pre-COVID times, COVID times. We're slowly transitioning back to in person again, and we're very happy with our newest class. Just started about a week ago. So many research opportunities. You really won't know what to do as far as who to work with and how many different research opportunities that are available, not just within the PM&R department, but Stanford as a whole. This is just limited to our PM&R department. As you can see, very productive, very easy to get exposure if that's something that you're interested in. Again, it's not something that is forced upon anybody, but it's available and there if you want to and if you're interested. And we have a resident research day every year where we get the opportunity to highlight our research experiences, and that's very well received. Our didactics every week, protected time on Wednesdays from 8 a.m. to 1 p.m., which is a very unique part of our program. So no no phone calls taken during that time, all protected, everything done by attendings. We have lectures from our PM&R department, but as well as our orthopedic surgery colleagues, neurosurgeons, rheumatology, neurology. We have a ton of outside faculty that lectures as well, especially during COVID. We've been able to reach out to other programs to help give us more exposure for our didactics. We have hands-on physical exam, ultrasound, board review, a very unique aspect of our program. We actually get to take advantage of cadavers yearly through the Stanford School of Medicine and practice ultrasound techniques. So that's something we try to do early in the residency to get residents exposure to anatomy. Some of the extracurricular highlights, we had UltraFast yearlies put on by the emergency department at Stanford. We teach the MSK portion to Stanford medical students. We have our free Arbor clinic, which is our outreach clinic to the community, where we work with patients on MSK issues who are underserved. And then plenty of sports coverage. Big advantage of having our sports fellowship in-house. We have a ton of different opportunities to work with pretty much every one of the Stanford athletes if you so want to. Some tech opportunities appropriately in the Bay Area. The Stanford Center of Biodesign coordinates with us and with the community at large. It's an opportunity for residents to work with medical students, engineering students, other grad students to work on medical device innovation. You work on a clinical problem and try to come up with a solution to that problem. Here is an example of that from years past. From one of our residents who completed the program. We have 4 weeks of elective time, standard for every resident, but that can be expanded to more elective time depending on performance on in-service examinations. You can rotate through any department at Stanford, also can do away rotations with some of the premier spine and pain rotations that are present in the Bay Area and outside the Bay Area. We've had some international electives before, obviously on hold during COVID, but we anticipate that might come back. Some of the places where we end up, really there's no kind of preference on residents going into pain or sports or inpatient rehab. We have a good mix every year, and some years more sports and MSK oriented, some years more inpatient oriented. This last year we had 2 residents match for brain injury fellowship, 1 resident match for spinal cord injury fellowship, and then 1 resident match for interventional spine fellowship, and the other 2 did private practice. So really can go anywhere and do anything. This is our class of 2021 post-training placements who I just talked about. We also had a pediatric, fellowship this year, resident, graduate, and do peds. We've had palliative care in the past, so kind of the whole range of PM&R. Numbers, obviously California's an expensive place, Bay Area is an expensive place to be at. I'm going to be transparent with our salaries here. Stanford undoubtedly has some of the highest salaries, in the Bay Area, California at large, as far as salaries go. There's a ton of different additional opportunities, educational stipend, moving stipend, you name it, QI project, you can get a raise, technology stipend, etc. And here's the average cost. What I find is it's similar to any big city, New York, Boston, those kinds of areas. You'll find it comparable to that as far as living here. And these numbers can change depending on what location you're at. So living in the Bay, obviously great place to be. Golden Gate Bridge, Berkeley, totally, variety of different things that you can do, whether it's a city, whether it's the beach or the mountains, whether it's, this is some pictures of Pacifica. You can get to Tahoe quite quickly. Wine country, Sonoma, Napa, really close to the Bay Area, so take advantage of those weekends. Here is our Instagram, where you'll see updates from our residents. We are heavily involved in intramural sports teams through Stanford. We have beach days, we have resident retreat days, and we just like to have fun. Here's a picture from our winter formal at Stanford. And lastly, some advice for virtual interviews. Just treat it like a regular interview. Wear professional attire, and let us know if you have any questions about any of that. All right.
Thank you so much for that. The audience members, I can go ahead and ask your questions in the chat. We'll give a couple minutes for some Q&A.
Is there any winter sports coverage? I'm sure there is. I personally have not taken advantage of any winter sports coverage, so I'm not sure what that would be, but not that I've heard of. Community outreach, the big community outreach opportunities through our Arbor Free Clinic. That's something that's held every few months. We run the MSK portion of that. You can get involved in a lot of committees through Stanford. to help interface with the community. There's no preference for applicants from the West Coast. We've had residents from the Midwest, from the East Coast, West Coast. Obviously, you know, that's something that everybody thinks about as far as where you'd like to be when you end up, but there is no preference held for that.
All right, looks like there's no further question. Anything else you want to add, Ms. that you didn't mention in your presentation before we sign off?
Favorite thing about the Bay Area? I would say just the ability to do anything. You know, you can go to Tahoe, you can go to the beach, you can get to the mountains, you can hike, you can have great food. It's just an incredible place. You can't beat the weather. And it's just a nice place to be with a ton of sunlight, which we love. First, for research, there's definitely funding support. It's not through the PM&R department, but you can apply for different grants through different departments, different outside institutions, but no formal funding per se from the program itself for research. We do provide some monies to as an educational stipend. I think it's $1,000 per year, which you can use for a laptop or anything you want, really. All right, I think that's it for the questions. So I want to wish everyone good luck, and I'll see you at the interviews.
Thank you so much for your time.
All right.
And thank you to our audience members for joining in. Feel free to look at our website and use the contact information that the speakers provided you. Thank you.